Hello?
Hi, everyone.
Oh, am I
Hi,
on?
everyone. Welcome. Yes, go ahead, Linda. You're on.
Okay, thank you. Okay, hello, everyone. It's nice to be here again with you. You know, this is a moment, an hour in my life every month that I really look forward to and enjoy very much. So I'm happy that you're all here today. I wanted to kind of bring up a sad topic to start out with because today is the 25th anniversary of Christopher Reeve's accident when he fell off the horse. Fortunately for him and for all of us, there were paramedics there at the horse trials, and so he was ventilated right away and went through the whole process of rehabilitation for spinal cord injury. And when I think back, 25 years ago seems like a long time ago. 25 years is a long time. But in the span of spinal cord injury research and treatment, it's a very, very short amount of time. When I think back 25 years ago, the way treatment was for spinal cord injury is just night and day different than how it was. After World War II, there was a big uptick in treatments and opportunities, rehabilitation therapies for individuals with spinal cord injury because in the World War II, they were able to reach people who were injured quickly on the battlefield and provide the care needed. So there were individuals who came home who had spinal cord injury and they needed care, and so the Department of Defense thought, what are we going to do with these individuals, and the VA got involved. And so things really started to pick up, but it wasn't until Christopher Reeve really got involved, and a lot just due to his determination and really his brilliance in looking at different therapies and learning everything that he could. He connected with a lot of people and really propelled rehabilitation. So nowadays, if you have a spinal cord injury, people are very much into advanced therapies, treatments. There's a lot more experimentation that's going on in the research laboratories. There's a lot of findings that they're really working on to develop actual cures and working on therapies that's going to lead to cures, so medications, surgeries, implants, just the whole plethora of things. Now, I realize that when you have you or someone you know and love has a spinal cord injury, each day is a day too many, each second is a second too many. But when you think about this 25-year time span and how things have changed and improved, we really are quite headed in the right direction. So that's, out of that horrible incident and tragedy has really come a miraculous thing for a lot of people. Of course, we're all locked in our houses with the COVID. This is kind of a dangerous time because things are starting to open up, which is good. We need to get the economy going. We need things to open up again. But of course, just because things open up doesn't mean that we are obligated to go out. And so if you have a spinal cord injury, you have risk factors that would make contracting the COVID virus much more significant for you than maybe somebody else who doesn't have a spinal cord injury. One of the things that the COVID virus has pointed out, and which a lot of people who have spinal cord injury were not aware, is that there's some immunosuppression, some immunocompromise that goes on in your body after a spinal cord injury. Now, up until this point in time, for the majority of people who have spinal cord injury, this really was not really an issue. They just were living their lives as they chose to live them, and it wasn't a real problem. But now that this COVID is out here, for anyone who has any kind of immunocompromise to their system, this COVID is a really dangerous thing in particular. So people are shocked when they have spinal cord injury and they hear that, oh gosh, I have immunocompromise. I didn't know it. I do not have a spinal cord injury, but I am immunocompromised, so I understand completely what's going on. I only became immunocompromised less than a year ago, and I tell you, I was thinking, well, okay, I have no spleen. All right, I'll just go on and live my life, as I had been doing. And then this COVID thing came along, and it's like, holy cow, this immunocompromise is a real issue. So this month I've been writing about the immunosystem and immunosuppression and inflammation, and then I tacked on insulin resistance, which is kind of completely different, but it all fits in together. But the immune system, the head of the captain, so to speak, of the immune system is the spleen, and it stores all those white blood cells that fight infection. The white blood cells are made in the bone marrow, and they get stored in the spleen until the brain says there's something in the body that shouldn't be, so release those white blood cells, and they're carried through the blood and through the lymph system, where they'll attack whatever the foreign object is, be it bacteria or virus. And so what happens after a spinal cord injury is that release of those natural antibodies that are made, we have antibodies that are made within our body. Sometimes, especially after a spinal cord injury, or there might be some interruption in the immune system where it can't send out those natural antibodies quickly enough. And so sometimes we have to take artificial antibodies or lab-created antibodies, which are just antibiotic pills, to get that virus or bacteria under control. Now, bacteria can be treated by antibiotics. Viruses are not treated by antibiotics. There aren't really treatments. There are some antiviral medications. There is no treatment for the COVID as of right now, but we hear on the news all the time all this progress that they're making, and everybody's putting all their effort to it. Scientists that don't usually work in the immune system are working in the immune system now because, this is such a worldwide crisis that we're in the middle of. But what happens after a spinal cord injury is the autonomic nervous system, as you know, is affected. The autonomic nervous system is part of the nervous system that works things just automatically. So one of the things that happens in the autonomic nervous system is when that bacteria is picked up in the body, it will tell the brain, send a message to the brain. The brain says, release those natural antibodies to confront the invader. And that happens unless there's a spinal cord injury and that message can't get through, or the brain can't communicate to the spleen to get that going. So that is a huge issue right there. And as I say, normally, it doesn't really matter that much. And it matters when you do get an infection. You need to alert your primary care doctor to that quickly, because bacteria will just live in your body and multiply inside your body. So you need to get antibiotics treatment. If you have a bacterial infection, you need to get that going early so that bacteria can be killed right away, because bacteria will change into something else. When it's confronted by even your natural antibodies or pharmaceutical antibiotics, the bacteria will try to change into something else, because bacteria are hardwired just to stay alive. They don't have brains. They don't have a nervous system to think about these things. But that's what they do. They mutate into something else. Viruses are a little bit different, because viruses just don't live on the inside of the body. They actually enter the cells of your body. They send their replication material into the actual cell of your body, which takes over the replication ability of that particular cell. So that cell in your body won't replicate itself to create a new cell like it, like if it's in your lungs and, you have cells in your body that are helping you breathing. When the COVID virus or any virus enters your body, it sends some genetic material actually into the cell of your body, which causes that cell to then start making more of the virus. So instead of making what cell it should be making, it starts making more virus cells. And that's why it's so difficult to treat, and why it's a bit different to treat, and certainly different than bacteria, and why antibodies don't work, because it's the genetic material. Now, there's some good news on the horizon, because they have been working, the scientists have been working for quite some time to develop a new way of treating viruses, and that is to go in and disarm this genetic material so that it doesn't affect your cells. So you could have the virus in your body, but if it can't replicate, you won't get the symptoms like you would if it was able to replicate itself. It would just die out eventually, or at least your symptoms would be a lot less. So they're looking at this new way of treating viruses and taking this new way that they've discovered to make the COVID-19 virus. So I'm very optimistic about that. It will change the way that healthcare is practiced. It will change the way viruses are treated. It will change the way that they treat a lot of different things. So this is going to be a very significant advancement as soon as they come up with that idea. Now, the immunosuppression or the immunocompromised is when your body doesn't have like that ability to fight infection like it did before. It can't really fight off those germs. There are increased exposures for individuals who have spinal cord injury. So you know, if you think about your own health, it's much easier to get pneumonia after you have a spinal cord injury because your respiratory system is affected. Even if you have a lower level injury, it takes abdominal muscles, are part of the 3 muscle groups that help you breathe, and so you need to have all those 3 muscle groups working well. So your lungs are more at risk. People who have spinal cord injury certainly notice more urinary tract infections, and there's always the risk of pressure injury, and should that injury open, should that wound on your skin open, you have a lot higher risk of getting an infection in there. So exposures to spinal cord injury infections certainly affect that immunosuppression in your body as well. Then when your body gets some kind of infection, it will develop what is called an inflammation response, which is a normal response. So if you think about if you get a paper cut on your finger, you know how those things, they're so sore. But if you get a little cut on your skin, it's kind of easy to see that inflammation response, because what will happen is that little cut might turn red because there's a lot of blood volume and fluid being rushed to that area to keep bacteria out of your body and viruses. So that you see redness, you might feel heat on that particular area. There might be some swelling because of all the extra volume. You might get a fever and pain. Now, if you have a spinal cord injury, you might not realize that you have some of those symptoms, because if you don't have sensation, you might not feel the heat, or you might not feel the swelling. You can see it, but you might not feel it. You might see redness, but you might not feel that pain that goes along that, is an alert to your body. Something's wrong here. You might you might notice fever. It might be your first response, or your first response might be an dysnomic response, where your blood pressure gets altered, and we have cards about autonomic dysreflexia from the Reeve Foundation, so be sure and always have that wallet card with you in case you get in trouble and you go someplace where maybe the healthcare providers don't deal that much with autonomic dysreflexia. So it's got a lot of information. Be sure and check the Reeve website for the wallet cards. So if you get in different kinds of problems with spinal cord injury, it has it all listed out, what you need to do, what your healthcare provider needs to do, and for the healthcare provider, it lists references so they can look up the correct treatments for individuals with spinal cord injury. It's kind of a very nice, kind of not obnoxious way of saying, I have a spinal cord injury, I think I have this problem, please treat me, with a standard of care. And it's not that your healthcare provider might not know what's going on. They just probably don't see a lot of people with spinal cord injury. It's really kind of a rare thing. So sometimes that gets overlooked. So sometimes that inflammation, you can see it real easily when it's on your skin, but your body's normal response to any kind of trauma or something that's not quite as it should be in the body is to have this inflammation response. And scientists are learning a lot more about inflammation. one of the things is that they know that when you have something like a spinal cord injury, when you have a disease like diabetes or arthritis, any kind of change in your body still detects, hey, something's wrong, and its natural response is to send that extra blood volume to the area, increase fluid to kind of cushion and protect that area, as well as you might get fever or pain if you have some kind of something that's going on inside your body. So you can't really see inflammation inside your body, but you might have symptoms of inflammation. And when the problem goes on long enough, this inflammation becomes chronic. And so they're still working on how to identify and treat internal inflammation. Now, there are some blood tests that you can take that will indicate if you have internal inflammation. So that's a clue to your health professional, but you might not, as an individual, even realize that you have this inflammation going on in your body. So now for all of these, getting the immune system to function well, if you have immunosuppression, if you have inflammation, there are things that you can do to kind of help yourself with those things. And the first thing is to follow a healthy diet, so eating a lot of fruits and vegetables, watching your carbs, watching your dietary intake, how much food you're eating. So being very careful about your diet. Sleeping, getting a good night's sleep. This is hard for some people when they have a lot of stress in their life. So if you can control your stress, or if you can learn how to deal with your stress, those are very important things to helping your immune system function better. Getting a good night's sleep, and this is really something that people are really dealing with right now, is trying to get a really good night's sleep because of all the stress of the COVID for those of us that are immunosuppressed. I know my sleep has just been horrible lately, and I keep thinking, I got to do something about this. So I'm trying to do that with diet and also with exercise, because if you can wear out your body, that will help you sleep a little bit better. And so if you can increase your exercise, now a lot of people with spinal cord injury say, I'm pushing my wheelchair all the time and I'm, going here and there. But what people forget is that your body below the level of the spinal cord injury still works. And that's a hard concept for people to kind of understand, because they say, no, I'm sitting here and I have paralysis and my body doesn't work. What doesn't work is the communication from your brain to your body and from your body to your brain. That message is not getting through. But if you supply activity to the parts of your body that are not working so well, that will provide that exercise that you need to the lower part of your body that is not working under your own command. If you can't do those exercises yourself, then have somebody do them to you. So that's helpful. Now, I will tell you, it's very, very difficult to exercise the part of your body that's not working so well, because number one, that your legs, or if your arms aren't working so well, those body parts are very, very heavy. So if you're trying to pick up your body parts and go put them through the range of motion, so moving every joint in your body, it's very heavy and it's very hard work. But as time goes by, you get stronger and stronger the more you do it, and you're easier able to do it. If somebody else is doing it for you, it's heavy and hard work for them to do it as well. They also will get stronger, and it's a good exercise for them when they're exercising you. So it's a bonus for everybody. The other thing about putting exercise into your life, if you're trying to do it yourself, is sometimes you have to get in awkward sort of positions to, range your toes down there and get your toes up where you can move your toes and move your hips and move all the joints in your body. It can be very awkward to kind of do that. So sometimes you might need a little bit of help getting positioned and getting those body parts moving. Another thing that's very important for the immune system is to stop smoking. Now, that's easily said, but it's very hard to do, because smoking is an addiction just like any other kind of addictions. And there are lots of kinds of addictions. So when people think of addictions, they think of drug addiction or alcohol addiction. But smoking is also an addiction, but there are all kinds of other kinds of addictions. You know, people have gambling addictions. People have sex addictions. We hear that a lot in the celebrity world. People are addicted to TV. People are addicted to food. So there's all kinds of, for any kind of thing you can do out there, there's an addiction that goes with it. Whenever you do something to excess that invades other parts of your life that you need to do. So like some people will smoke rather than eat. And they'll say, well, this is the way I'm controlling my weight. No, it's the way you're feeding your addiction is what's happening. You need to eat food to keep your body healthy. What happens when you smoke is you're inhaling that smoke into your lungs. There's a lot of nicotine. There's a lot of other products that are in the cigarettes that are then entering your lungs, that are going through your lungs and entering your body. Nicotine loves to attach itself to in your bloodstream. It loves to enter your body into your cells, and when it's entered into the cell, then oxygen cannot enter into the cell. So a lot of times before people have major surgery, they'll be required to stop smoking. It affects your circulation, especially as you get further away from the heart. So a lot of times people who have smoking have sores on their legs, not from pressure injury, but just from not getting enough oxygen, you know, down to their toes, to their feet, to the calves, that sort of thing. So there are treatments for stopping smoking. There's gums, there's therapies, psychological therapies that you can do. There's pills that you can take. There's a lot of things. Now, that all sounds like, oh, well, problem solved. No, it's very, very difficult because once you get that nicotine entered into your body, you become addicted and your body starts craving that nicotine. So it's hard to turn off that craving. It's also a habit, and it's very hard to break a habit. So stopping smoking is very hard, but keep trying because eventually you can do this. Sometimes people say, oh, I've tried stopping smoking 20 times. I've tried all the pills. I've tried all the counseling. I've done all the things. Yes, and those were 20 times that you tried, but the 21st time might be the time that works. So keep at it. Find a support group if you think that will help you. Can't go out now, but there are on the internet, there are groups that you can join. You know, check into them, make sure they're an accredited sort of group that, you know, is from a national organization rather than, you know, I'm just some guy and I'm going to help you to stop smoking. I mean, he might be the best one of all, but, you know, you want to stick with somebody who's got proven techniques as opposed to, you know, some guy who says, I got a great idea or something out of the normal treatment plan. The other thing to think about, and it starts with the letter I, but it kind of fits in with all of this, is insulin resistance. And a lot of people don't think about this, but insulin resistance comes from a sedentary lifestyle. So even though you might be moving around in your wheelchair because you're propelling it with your arms, your legs aren't moving, you aren't exercising those large, especially those large thigh muscles. And that's where most of the sugar in your body gets metabolized because those thigh muscles are so large. They're the largest muscles in the body. So you need to exercise your legs and get those moving. With insulin resistance, if you have insulin resistance, it can lead to type 2 diabetes. But you can stop that from progressing if you get on top of it soon enough. So it's never too soon to start exercising the part of your body that doesn't work so well. What happens is that you have insulin inside your body. We all know that people who have type 1 diabetes, that's the type of diabetes where your pancreas is not making enough insulin. It really starts at birth, although some people don't really fully evolve into it until, you know, they're a little bit older, like 5 or 6, or some people don't even get it till 10 or 12. We hear people getting the type 1 diabetes even later in life. But most people later in life develop the type 2 diabetes because of their sedentary lifestyle and a little collection of weight over the years, all those kinds of things. So when you're not using those muscle groups, you tend to get more prone towards this type 2 diabetes. So again, it fits in with the immunosuppression. So if you think about when you exercise your body, just think of all the things that you're doing. You're shaking up your bladder, which reduces the chance of infection. You're moving, when you move your legs and you move your hips, you're moving your abdominal muscles because the muscles all work together. And so you're moving those muscles as well, so you're helping your bowel program to work better. You're moving your body, which is building a little bit of muscle, hopefully, which is reducing your risk of pressure injury, and you're improving your immune system, which is thereby reducing your immunosuppression and possibly your inflammation. So when you exercise, all these wonderful things happen. Watching your diet helps insulin resistance and smoking. The reason why we naturally make insulin in our body is because when we eat sugars, that's what transfers the sugar into our blood cells. So sugar doesn't pop in there by itself, but the insulin carries it on in there. Now, when you have type 2 diabetes, normally you don't take insulin. You take other kinds of medication that produces that transfer. So anyway, it's just something to think about in my little promotion of exercise, especially while we're in the middle of this COVID. So with that, let's go ahead and look at some of the questions. And the first question is there's not much information here, but I do want to address it. Somebody has written in, and it says, I feel like there's something wrong with me. Well, we all have that feeling on occasion, but I'm thinking that because you took the time and the energy to write in that you really have a concern about something physically or maybe something mentally or a combination of something that's going on. And if you read my columns, my blogs, you know that I'm a real advocate for mental health. Having an issue or worrying about your mental health does not mean you have mental illness. It's really rather normal. And we should all be worried about our mental health, and especially now that we have this oppressive COVID thing hanging over our head, we really need to take care of our mental health, just as we need to take care of our body and exercise and feed it the right nutrition and give it the right amount of fluids. We also need to take care of our mental health. So if you're feeling really, and this applies to anybody, but especially this person that has written in, if you're really feeling very seriously that you're having some negative thoughts and you're really having some trouble, even if you're not thinking about suicide, but you're having some mental health trouble, you can get help right away, and it's very important that you call the National Suicide Prevention Hotline. It's a lifeline, and they will help talk you through what your issue is. They'll help connect you with people right in your community where you can get more help. It's very critical that you call. So you don't have to be thinking of suicide, but if you are, or if you're thinking you have mental health problems, or something's really weighing on you that is just so oppressive in your life, it's time to call. And that number is 1-800-273-8255. Now, it's all anonymous, so you don't have to provide information if you don't want to, but you can talk to somebody. They're very non-judgmental, and they will listen. So it's time to call that number. If you don't want to call anonymously, call your primary care provider and get a referral to somebody locally, because this is not something that can be messed around with. This is something that needs to be taken care of right now, immediately. So I hope that you will call in to the mental health hotline and seek some assistance right away. And please feel strong about doing that. That's a real commitment to make to yourself, because we should all love ourselves the most. And so do that for the person you love the most, and that is you. So I will wish you well, and please let us know how you're doing with that if you feel like you want to share with that at any time. The next question is about muscle spasms in the legs, and I know we have a lot of questions coming up about muscle spasms, so I'm so happy these questions are coming up. So this person has been using diazepam or Valium for nearly 60 years without side effects. Now, that is a long time, but apparently it was working, and if it's working for 60 years, then bravo. but he's also recently used, so there must be maybe, any medication for spasms, your body tends to become accustomed to over time. So these medications often have to be upped throughout the years. Sometimes there are new medications that come out, and that's helpful, and so sometimes people switch their medications around. Baclofen is another medication which is used for spasms. He says he's having a hard time getting, I think, his Valium because it's now considered an opioid, such as OxyContin, and that's part of the opioid epidemic. And so it's kind of hard to get some of these drugs now. Baclofen is not on that list, but Valium is. So 60 years, that's a long time to be taking a drug, and so I'm sure that he's needing his Valium after 60 years. And so he probably would like to keep on that because it's working for him. It's hard to switch on to a new drug once you have something working for you, but sometimes we have these things that come up and, it's a whole big deal and, you have to switch. So there are some other things that you can do also for spasms, and that is to treat them locally. So Valium is a treatment, Baclofen is a treatment. You can take some antidepressants that will treat spasms, and some people will say to me, but Linda, I'm not depressed. Well, one of the side effects of the antidepressants and also seizure medication, anticonvulsants, the side effects of those medications is the reduction of spasms. But when you take them for spasms, they're not given in the doses that will treat depression. So even if you take them, it's not going to make any difference in depression. You don't have to have depression because they give it in such low doses. So, for example, for antidepressant medicine might be given and there's several in the different families of antidepressants. They might be given at 100, 200, 300 milligrams per day, whereas when you take those antidepressant or anticonvulsant medications, they're given in like 5, 7, 10, maybe 15 milligrams just to start. So people tend to like those because you don't get the systemic effects of oral medications, so like Valium, the antidepressants, the anticonvulsants, Baclofen, they work throughout your whole body. They don't discriminate. They don't go just to that muscle where that spasm is occurring. They work throughout your whole body. So some people get a brain fog, so to speak, because it's that drug's going through your brain as well and through your nervous system. So some people feel like, this is making me a little confused, or I feel like so sleepy all the time, especially when you have to up your dose or when you have to change medications. So people don't like that brain fog. But a lot of people are using Botox, and that seems to be the way that most people are going now because Botox is an injection, and it's injected right into the muscle where the spasm is occurring. And it stays pretty much locally within that muscle because it's injected there, so it doesn't really travel continuously throughout your body. You do have to have repeat injections about every 6 months. If you have really bad spasm in a muscle, you might have to have it every 4 months or every 3 months. But it's very safe to be taking this. It's what most people are taking now. So it might be a good idea to try to not on your own, because you never want to stop Valium or Baclofen on your own. Those drugs have to be tapered off because there is a little bit of an addictive quality to them. And if you stop cold turkey, your spasms become so much worse. And when you start after stopping on cold turkey and you try to take a new medication to control your spasms, it's very difficult to get any medication to work. Even if you would be able to go back on the Valium, if you stopped at cold turkey, when you go back on the Valium, it is so difficult to get the Valium then to work. So that stopping abruptly of these particular medications is something you should never, ever do. always talk to your healthcare professional, and always have a taper, a little system where you take a little less, maybe every week, maybe every day, but usually it's more like every week you cut down just a little bit so your body gets used to being off that medication. When you go that hard cold turkey, and I talk to people about this all the time, and a lot of people will go home and they're like, I'm tough. I can stop this. I can do this. I'm just going to stop it anyway. And they do, and then the next time they come back, oh, the new medicine won't work, and the pain is so unbelievable. So don't stop at cold turkey. It doesn't matter how tough you are. Just don't do it. You need to have that taper. But, so the Valium is getting harder and harder to get. It's unfortunate if it's been working for 60 years. What works, why change it? But, this is a part of our culture of today. It's hard for physicians to justify, under their medical license that they're giving somebody consistently Valium. So it's not really that the physician doesn't want to give it to you because of these rules. It's really his medical license that's being threatened by prescribing it. So, it's one of those catch-22s. If it's working, you don't want to give it up. It's going just fine. But, you might want to consider the Botox injections. Now, another thing, if you find that baclofen is working, but you have to take such a high dose of it, there are little pumps, implants that are implanted into the abdomen where baclofen is placed in that pump, and then there's a tube that threads around to the spinal cord, and it will bathe the sac that the spinal cord's in. You can't put anything into the spinal cord because that would do more further damage, but it's the sac that holds the spinal cord, and then this baclofen just bathes the spinal cord at all times, which reduces the spasticity in the whole lower half of your body, or if it's placed a little bit higher, you can get relief from arm spasticity as well as if you have any internal spasticity in your abdomen. That's affecting, maybe your bladder or your bowel or maybe even your breathing. So that pump has to be refilled periodically depending on how much it's releasing constantly in your body. Before you get the pump, you have a test where they actually do an injection into that sac around the spinal cord of the baclofen. And you'll see people that go through this trial to see if it works, because you don't want to have this pump implanted that's, if it's not the right thing for you. So you have the trial to see how it works, what the response is, and you see people just unwind and their body just relaxes. And they're just euphoric because they're so happy because it's such a great feeling. It doesn't affect your brain because it doesn't get up to your brain, but they just get so happy without this, without all these spasms going on in their body. The bad part of the trial is that wears off, and then you have to wait to have the baclofen pump implanted until you get that relief again. And that is always the biggest trial, but that's used a lot. It's used in adults and it's used in children. So that's for really severe spasticity. But since you can't use the Valium, it might be a consideration to talk to your doctor about Botox injections to see if that will help, and then that treats just locally. But be sure you taper off any kind of medication that you're on for your spasms that you're taking orally. Now, another question that we have coming up is, and this one's come up a couple of times as well, so we're seeing a lot of advertisement for this supplement. I'm going to call it a supplement called D-mannose. And it's a pill that's taken for treating urinary tract infections. Now, this is something that's gone around in the community for a number of years, talk about 25 years of spinal cord treatment. So back in the day, 25 years ago, we used to give everybody cranberry juice as a way of changing the pH of the urine to be more acidic was the thought, and that you'd have less infection if your urine was more acidic. So people were given cranberry juice, but they've done a lot of testing on that, and they found that really did not make a difference in the pH of the urine. So, and plus, cranberry juice has an awful lot of sugar in it, so people who have spinal cord injury can become insulin resistant and develop type 2 diabetes. So drinking all that cranberry juice was not really a healthy idea. So then they started giving it in pills, and the research showed that it really didn't do that much. Now, this pill, this D-mannose, is cranberry powder, like in that pill, so it doesn't have the sugar, but the other part of it is sugar. So it's, and that's why it has the OSE, because it's a fructose, sucrose. Those OSE names are always sugars. So you're getting cranberry powder and you're getting sugar. Does this work? It's not a prescription medication. It's an over-the-counter type of medication. So be sure and talk to your healthcare provider because you're taking a sugar pill. You might not want to be taking a sugar pill. Some people are going to go ahead and try this, and they're going to swear that it works for them, and maybe it will. I don't really know of any research that says if it works or if it doesn't work. It was originally formulated for women who get a lot of urinary tract infections just because of the way the anatomy is. So it was usually developed for women who are pregnant or they're getting a lot of urinary tract infections just for whatever reason. So it's a dietary supplement. So you always want to tell your physician and your pharmacist every pill that you take that's prescribed, but also every single supplement, because it could also interfere with a pill that you're taking. So it could create a combination that would be negative to you. So always be sure and have everything checked out. Also, if you have insulin resistance, you surely don't want to be taking in any added sugar. So those are the things. So if you're thinking about taking this supplement, be sure and talk to your healthcare provider so you know how it will affect your personal body. So a lot of times people think, well, it's over the counter so anybody can take it, but it might react differently for you if you do tend to run high glucoses, or if you might be on the verge of insulin resistance, or you might be on the verge of diabetes. It's the same thing like people who take Metamucil for their bowels. You always want to look at your packaging and be sure and tell exactly what you're taking, because the regular Metamucil has a lot of sugar in it. So for people who have spinal cord injury, you might want to pony up the extra bucks for the sugar-free Metamucil, and that way you're not dosing yourself with lots and lots and lots of sugar. So a lot of times even people who are diabetic and they're recommended to take the Metamucil, they don't stop and think, oh, I need to take the sugar-free kind because it's an over-the-counter supplement. So that's something that you really want to talk to your doctor. So is it going to be a guarantee? Well, there is no supplement that's a guarantee for everyone. So it might help some people. It might do nothing for other people. And for a third set of people, it might actually be detrimental. So be sure and talk to your healthcare professional, because now you know about it, what it is, and how it works. So research has shown that the cranberry powder doesn't really do anything. Extra sugar in the bladder is really something that encourages infection because bacteria love to live on sugar. So does this combination help? That we'll have to wait and see. Hopefully there'll be some more testing. Maybe somebody in a rehab center will test it and we'll get a definitive answer. Right now that is unknown. I'm sure that the company has some research that they've done that will indicate that this is a very successful product. You always need to be leery of that, because if there's research that indicates that it's not a successful product, the company will not advertise that research. So you have to be consumer-wise when you're looking at some of these kind of things. Oh, this is another great question. Wouldn't it benefit for a new SCI patient who contracted the virus in the hospital and who's been in isolation, no rehab for 3 weeks, to go back to inpatient rehab before coming home? Well, I will tell you this. For anybody who has contracted the COVID virus, that's been sick enough to be hospitalized, I think rehabilitation is important for absolutely anyone. for somebody who's been in the hospital with that, hopefully their rehab has continued. Now, the rehab that's been provided in the hospital, because they don't want people out in the hall exposing more people, the rehab has all been in the rooms. So for people in general rehab and inpatient rehab in the hospitals, this has been a very difficult time. They're getting rehab in the room, but the big equipment is in the gym in another place. And so it hasn't been that they've been getting a lesser program, it's just that they've had to adapt more of the programs. And so, but I think for anybody, if you have a spinal cord injury or if you don't have a spinal cord injury, rehabilitation is very important because, what we hear on TV is that you either have the virus and you have muscle weakness and you feel really bad and you stay at home because you don't have that bad of a case, but you have this muscle weakness, so you've lost your tone, you've been laying in bed for a couple of weeks, you've been really sick, so your strength is really gone. If your strength is gone, your balance is gone, and this is talking about anybody. Then the other group of people we hear that have the COVID who've been in the ICU, they've been on ventilators. What we're not hearing is that they're probably also on dialysis. They're probably also on cardiac life support maybe. They're on lots of medications. They're laying in the hospital bed maybe for months at a time. And if you have a spinal cord injury, you're further compromised if you have to be in the hospital, either generally in the hospital or in the ICU. But the only thing we hear about are those people that die, because they've gotten so sick with it. But there's this massive group of people that have come out of the hospital, they've come out of the ICU, they're surviving, and they're just really still debilitated when they're discharged from the hospital. So the government has, in some of their new regulations, have made allotments for this, and I've been involved in several conference calls where they have been talking about people who have had the COVID are eligible for rehabilitation. So maybe your local hospital might not be aware of this, but if you go to the CDC website, I think you'll be able to find information about a rehabilitation after having the COVID, and there are allowances for this, and there are allowances for people to go to rehabilitation hospitals depending on how debilitated they are, and there's allowances for people to have outpatient therapy and requirements for insurance to pay for some of this therapy. So if you look in rehabilitation after COVID, maybe you'll be able to find some of these government regulations. Hopefully the case manager from your insurance company will be aware of this. Hopefully your case manager in the hospital setting, hopefully your healthcare provider will be aware that this is a possibility. So that is a possibility for people to go back into inpatient rehab, but it depends on how debilitated and how sick they were with the COVID. So, getting into rehabilitation programs, there are criteria, and there are also criteria for people who have had the COVID. So that is a total possibility. So be sure and look into that, because that's a definite thing out there. Here's a question about advice for decreasing urinary infections, which kind of plays into that other medication that we just spoke about. So when some people just tend to have more infections than other people. Some people have the worst technique for catheterizing, and they never have an infection. Other people follow catheterization technique to the letter, and they have infections. Why? Who knows? We don't really know. It could be maybe the immunosuppression of your system. It could be any of 1,000 things. So what I always recommend is, if you're looking to decrease your urinary tract infection, is number one is to look at your technique, to review. Are you washing your hands carefully before? Do you wash your hands and then use your wheel rims to go to the toilet to catheterize? You've recontaminated your hands if you have. So if you catheterize on the toilet, you'll need to sanitize your hands after you get on the toilet, after you grab things to do your transfers and touch your wheel rims and all that. So look at your technique. If your catheter hits up against your thigh or doesn't hit the entry to the urethra, you've contaminated your catheter. You need to get a different one. So look at your technique. Another thing is to look at your fluid intake. If you're drinking a lot of sodas, if you're drinking alcohol, all of this has sugar in it. Caffeine can affect your urine and urinary tract infections. So look at all those things of what you're drinking. Water is probably the simplest thing. Juices also have a lot of sugars in them. Look at what you're drinking. Plain old straight water is probably the best. Now, people who are doing intermittent catheterization do have restrictions on their water so their bladder doesn't get over-distended or they don't have accidents. So you might increase your water just by taking a few little sips every hour or so, just a little bit of an increase. Talk to your healthcare professional. You don't want to do that if you also have cardiac problems. But can you increase your fluid intake just by a tiny little bit? Now, this does not mean you have to give up your morning coffee. It does not mean you have to give up your evening cocktail. It doesn't mean any of those things. But just look at the amount of sugar that you're intaking through your diet as well as in your fluids. So some people live on those sports drinks, lots and lots of sugar in there. So look at the content of what you're drinking. Water is always a safe bet. If you have a certain number of infections, and different insurances do this different ways, but if you have a certain number of infections within a certain time zone, you can apply to your insurance company to get catheters that are in the sterile box like you did at the rehabilitation hospital instead of using the clean catheters, and they will pay for those. So go to your, you get a book from your insurance of what they cover. You might have to look your policy up online, and the policy will be listed there. Now, you can't go in and say, I have a Blue Cross policy, because there's like 500 policies under Blue Cross. You have to know your policy number, which will be on your little card, or you can call the number on the back of your card and find out what their rules are for number of infections and timeline. And if you fit that criteria, then you can have contact your insurance case manager, because they'll be able to look into your medical record and see, yes, you did meet that criteria, or talk to your primary care physician who can start ordering those new catheters. They will have to, send a letter of medical necessity and, demonstrate that you actually had those infections, and then you can advance up, and that certainly helps. If you can't advance to to a higher level of catheter, another thing that you can do is buy sterile gloves on your own, or even just buy the clean gloves on your own and use those before you catheterize, and then throw those out. The sterile gloves are very expensive. The clean gloves aren't nearly as expensive. They're the same kind you use as your bowel program. So you might be able to buy some of those on your own. It can be pricey, when you're on a fixed income, but it might be worth the price than having all those bladder infections. So that's something. And certainly exercise. As you move those hips, as you move your body, as you roll back and forth in bed. Sometimes I'll have people just roll back and forth because that's moving the urine around in the bladder. When you're just sitting or you're laying still, that urine is still in your bladder. So I like to use what I call the James Bond approach, shake that urine in that bladder. We always did that, shaken, not stirred. Well, we can't stir our bladders, but we sure can shake them. So that helps a lot too. Here we have a gentleman who's 88 years old. He takes Neurontin, and he started having burning from the knee down at night. He wonders if he exercises, he can go back to sleep most of the time. Any suggestions? Well, Neurontin and Lyrica are two drugs that are particularly made for neuropathic pain. There are other drugs that you can take that can help neuropathic pain, again, those anticonvulsants and antidepressants, but they work differently. So Neurontin and Lyrica are the only drugs that are made specifically for neuropathic pain. So if you're having this breakthrough in the night, you might need to up your Neurontin a little bit. So you'll need to talk to your healthcare professional. Neuropathic pain is different for everyone, and it's very subjective, because the only way to measure it is by what the person who's having the pain tells you. So we could be having the exact same neuropathic pain, and I could be saying mine is the worst. It's 10 out of 10 pain. And somebody else could be saying, oh, no, mine, it doesn't bother me too much. Like this gentleman, oh, I exercise and I kind of get past it, but it disturbs my sleep. And we know how sleep is very important. So talk to your healthcare professional about maybe upping your Neurontin just a little tiny bit to see if maybe that would help. So now we are coming to the end of our time, and I always hate it when we're coming to the end of our time because there's so many more questions. I hope that many of the questions I've answered already because, some of them are kind of related to other questions, so I try to expand those answers to cover some of those. But also do remember that there's also the community on the Christopher and Dana Reeve Paralysis Foundation website. And there's a lot of information you can get off that website. There is information. You can go into some of the educational materials. There's information for people who are newly injured. There's information for people who've been injured a long time. So there's just a whole lot of education. There are those wallet cards that I spoke about that's important. They're kind of spinal cord injury emergencies. So if you find yourself out someplace where you're not with your usual care provider, they're good to have in your hand, and they're the size of a dollar bill, so they fit inside your wallet. So you always have it with you, and you can just print those off. So they're very, very handy. There's also booklets on spasticity, bowel programs, just all kinds of information about just about anything that you would like to know. There's also a paralysis reference guide, which kind of goes from A to Z. It's got everything that you might want to figure out how to do, from treating your spasticity to finding a support group to meeting new people, just all kinds of things that you might want to know about. There's also the blogs on there. There's a section called Community where you can communicate with other people who have spinal cord injury. That's in that community. There's like a little inbox. So if you would like to messenger me, you can put a question in the community that everybody can see, and that's always beneficial. And address it to Nurse Linda. That's always beneficial because if you have that question, I guarantee you thousands of other people have the same question. So you might be helping out a few extra other people if you ask it publicly. You can also put it in my inbox, and so you can ask information to me privately if it's personal. You don't want to put that much information about yourself out online. There's also, you can reach the peer mentors, which is another wonderful thing that they have through the Reeve Paralysis. So it's people who have spinal cord injury that are in your community or close by your community that you can ask them things about, what's going on, how are you dealing with the COVID here in our community. So there's just a whole bunch of kind of things that you can find out about and connections that you can make. So there's wonderful resources. When you get into the foundation website, there's just absolutely wonderful kinds of things. And as a matter of fact, through the website, I made a new friend this week. His name is John, and I know he's listening, so I want to say hello to John. I'm in the house with this COVID, and so, it was just real nice to make a new friend this week. So friends come in all different kinds of ways, and we're supposed to maintain our social distance, but that does not mean social isolation. So contact your friends, maybe people you haven't talked to in years, and just find out what's going on with them. Telephone them. Use the internet, talk to friends that you talk to every day, but, find somebody to chat with and let's do it. So thank you for your time, and please be sure to check in on the community at any time. And I appreciate you being here today, and I hope to talk with you again next week. Thank you so much. Have a good month.